bringing you the latest health coverage and medical news. Here's Karen McKay's HealthWise at 5.
Dr. Cathy Wittman comes up to us from the Department of Ophthalmology at the Texas Tech Health Sciences Center. Nice to see you with us.
Good to see you.
She's here to talk about a subject dear to my heart, dry eyes and allergies, and a lot of us are suffering right now, right?
You're not alone. A lot of people are having dry eye issues right now, and we're seeing more contact lens dry eye problems, more redness, watering, itching, irritation, and there are some things that you can do about it.
So what are your tips?
Well, there are actually mainly two different causes of dry eye, either inadequate tear production or increased evaporation. So one thing that you can do if you don't have good tear production is you can use artificial tears more often. You can get something from any of the grocery stores or the pharmacies, but a lot of us have trouble with evaporation, and right now it's really, really dry, it's really, really hot. And so what you can do about the evaporation problem is you can help your meibomian glands to work better. And let me tell you what those are. We've got special oil glands that produce this lubricating oil, and it helps prevent our tears from evaporating. And I see this a lot where those glands aren't working properly.
So what do you do to get them going?
Well, there are certain things that your eye care provider can do in office. There are certain prescription eye drops that can help. I do tell my patients to practice good lid hygiene. When you take your shower or your bath, if you do warm compresses with your washcloth, and your eye care provider can explain in more detail how to do it. But if you practice good lid hygiene, it'll help those oil glands. But some people have more trouble than just using tears and doing hot soaks and lid scrubs, if that's what we call it. And those people need maybe sunglasses with side shields. You can buy them with foam inserts. Your eye care provider will sometimes sell them in the optical, sports-related sunglasses that do a good job of protecting your eyes from the elements.
Because basically it's wind and dust that's aggravating us so much right now, right?
And when we're outside, it's like a hair dryer blowing on your face, and when you're inside, it's the dry air from the air conditioners. And so if you can protect your eyes from the elements indoors, maybe add a humidifier. We have a humidifier at my house. It really helps. And really see your eye care provider, because you don't have to suffer. It's really an inflammatory process, so those over-the-counter drops won't help with the inflammation, and your eye care provider can prescribe some things to calm down that inflammation. Without that, you're just going to struggle. You'll use those eye drops all day long, and you'll still have either watering or redness or itching or a gritty, sandy sensation.
Could we be adding the problem with makeup? Can you be doing anything to your eyes, or petroleum jelly and take the makeup off with that?
I sometimes see some women who put eyeliner on the inside of their lash line, and what you're doing is you're smothering your meibomian glands. Don't do that. So there are certainly some things and changes that you can make that will help with the dryness issues.
Okay, thank you very much for your tips. Dr. Cathy Wittman is from the Department of Ophthalmology at the Texas Tech Health Sciences Center, and it's nice to see you again.
Good to see you, Karen.